Okay, hello everybody. I hope you're doing well during these crazy times. I will be doing the second part of the presentation, and yeah, I'm just gonna start right away. Right away. So the first treatment I would like to present to you is called the Psychodynamic Therapy. It's another psychotherapy, and it focuses on the interaction between the mental processes which are generated by the experience of the patient and the behavior of the patient at the onset of the depression problems. And the aim of this therapy is to strengthen the patient's capacity to understand the reasons for their subjective experiences and the underlying meaning of it. Yeah, and it also focuses on the understanding of the own behavior and the behavior of others. So, with this treatment, the therapist tries to strengthen the awareness of the unconscious processes that are going on within the patient, and also the influential factors from the environment that have an influence on the unconscious processes. This helps the patient to understand sort of what's going on inside the head, and that helps to tackle overwhelming anxieties and pressures. Um, yeah, and this treatment has been shown to be very effective. So just like the other psychotherapies, actually. Um, and on average, between 20 and 40 sessions are needed, but it actually can take more. So yeah, if compared with other treatments, this is actually quite an efficient treatment. Okay, so then the next treatment I would like to call the electroconvulsive therapy, and this is actually quite an extreme treatment because it basically is a seizure which is elicited during a short anesthesia. So yeah, it's very extreme. So of course the patient has to give informed consent for this. It is actually the most widely used and most effective non-pharmacological treatment that is used for treatment-resistant depression. So yeah, when those sort of other treatments that are less extreme did not work. And it is especially used in very severe cases of depression, such as when someone is highly suicidal. So it's used whenever a very immediate antidepressant response is required. But it has a big disadvantage, which is the side effects, because it has very adverse effects on cognition, such as anterograde and retrograde amnesia. So that's quite extreme. Moreover, there is the possibility to use the treatment unilateral or bilateral. And surprisingly, both treatments have been proven to be very effective, like equally effective actually. But the bilateral treatment elicits a way faster response. So if it's a very urgent case, like a very highly suicidal patient, it's better to do the bilateral treatment. Then there is another treatment that belongs to that's also sort of an electroconvulsive therapy, but then way less intense. So it's a weaker version of it. It's called the ultra brief pulse width. And the big advantage of this is that it has way less adverse cognitive side effects. So it does not cause amnesia in most cases. But the problem with this is that it's way slower and also less efficient. So yeah, it doesn't really, like, if it's a very severe case, it does not really it's not really a good option. Okay, and then the last treatment we would like to present to you is technology supported treatment. The technology supported treatment is just a behavioral intervention, which is done through the phone, the laptop, or the tablet, or like basically any technical device. And this behavioral intervention has the aim to teach self-management skills. This treatment is effective when it is combined with internet tools, and it has shown to be most effective when it is combined, like the internet tools are combined with low intensity coaching on the phone. The most obvious and the biggest advantage of this is that it is very cost effective. So yeah, very, very low costs are involved. But the research still has to examine which kind of patients respond best to the technology-based treatments, and yeah, which would be better for a traditional treatment, a more traditional treatment. Another big advantage of this is the digital phenotyping. So digital phenotyping is basically using data which is generated in daily life, and it's gathered through phone sensors, collected through phone sensors. And through that, behavioral markers can be created which relate to depression and depressive symptoms. And since people tend to always keep their phone with them, the phone then can measure the severity of the depression in real time, which is a big advantage. So then that enables an immediate intervention. Yeah, and it's also possible to monitor the patient passively, and yeah, therefore it is a continuous patient-centered treatment, which is a very cool thing. Okay, thank you very much for your attention. These are the discussion questions. You can also find them on the drive. Yeah, please make sure to read them. And yeah, I see you guys tomorrow in our interactive discussion session. Okay, goodbye.